MLT Case Study Series 20. A case study on the topic. Unveiling the Veil, a journey through hereditary hemorrhagic telangiectasia. Decoding Osler-Weber-Rendu disease, a comprehensive case study on diagnosis and management. Introduction to Osler-Weber-Rendu disease. Osler-Weber-Rendu disease, or hereditary hemorrhagic telangiectasia, HHT, is a genetic disorder that affects the blood vessels. It is characterized by the development of abnormal blood vessels called telangiectasias and arteriovenous malformations, AVMs, in various organs. These abnormalities can lead to bleeding, anemia, and other complications. HHT is inherited in an autosomal dominant pattern, meaning a mutation in just one of the two copies of the gene is enough to cause the disorder. Pathophysiology. HHT results from mutations in genes involved in the development and regulation of blood vessels. The most commonly implicated genes are ENG, ACVRL1, and SMAD4. Mutations in these genes disrupt the signaling pathways responsible for vascular development, leading to the formation of fragile, abnormal blood vessels that are prone to bleeding. Clinical presentation. Patients with HHT can present with a wide range of symptoms, including recurrent nosebleeds, epistaxis, often starting in childhood. Multiple telangiectasias on the skin, especially on the lips, nose, fingers, and ears. Internal bleeding from AVMs in the gastrointestinal tract, lungs, liver, brain, and other organs. Anemia and fatigue due to chronic bleeding. Shortness of breath or migraines, which can be symptoms of pulmonary or cerebral AVMs. Diagnosis. Diagnosis of HHT is based on the Kurosawa criteria, which include spontaneous, recurrent epistaxis, telangiectasias at characteristic sites, visceral lesions such as gastrointestinal telangiectasia or pulmonary, hepatic, cerebral, or spinal AVMs. A family history of HHT. A diagnosis is considered definite if 3 criteria are met, possible or suspected if 2 criteria are met, and unlikely if fewer than 2 criteria are met. Genetic testing can confirm the diagnosis and identify the specific gene mutation. Management. Management of HHT focuses on treating and preventing bleeding episodes, managing AVMs, and screening for complications. Strategies include medical management with iron supplements and hormone therapy to reduce bleeding, surgical interventions to remove or reduce AVMs, embolization procedures to block off AVMs, particularly in the lungs and brain, regular screening for new AVMs in vital organs. Sample case study. Patient information. Age, 32 years. Gender, female. Chief complaint, frequent nosebleeds and red spots on lips and tongue. History. The patient reports experiencing nosebleeds since childhood, occurring 3 to 4 times a week. She has noticed small red spots on her lips, tongue, and fingers that have been increasing in number over the years. There is a family history of similar symptoms in her father. Physical examination. Multiple telangiectasias noted on the lips, tongue, and fingers. No active bleeding at the time of examination. Diagnostic evaluation. Complete blood count shows mild anemia. Genetic testing confirms a mutation in the ENG gene. Management. The patient is started on oral iron supplements for anemia. Hormonal therapy with estrogen is initiated to reduce the frequency of nosebleeds. The patient is referred for pulmonary AVM screening via CT scan and echocardiogram to assess for shunts. Discussion. This case exemplifies a typical presentation of HHT with recurrent epistaxis, telangiectasias, and a family history of the disease. The diagnosis was confirmed through genetic testing, identifying a mutation in the ENG gene. Management focused on controlling symptoms and preventing complications, highlighting the importance of interdisciplinary care in managing HHT patients. Conclusion. This case study can serve as a valuable tool for medical lab technologists to understand the clinical presentation, diagnostic approach, and management strategies for Osler-Weber-Rendu disease. Through such detailed case studies, Technologists can enhance their knowledge and contribute effectively to the diagnosis and management of HHT in clinical practice. Thank you. Please subscribe for more videos.